Hair loss is an embarrassing issue for anyone, but when you're hosting a daily television show, it can be a real problem.
Dr. Ashton is here for a PRP, platelet-rich plasma treatment of injections into her scalp for her hair loss.
A month ago, I had my first treatment. I'm here for my second treatment. I looked like a balding man, and it was really starting to bother me. What's involved in the PRP treatment?
We get some blood drawn. We draw up the platelet-rich plasma. We will put some numbing cream on your hair before you start, and then we'll inject the PRP into the areas where you've lost the hair. I'm going to do the frontal hairline, do the couple areas that she wants to do, and I'm also going to do the hairline. And we're done, okay?
Whew. That was a little less painful than having a baby.
We're joined by Dr. Jeffrey Rappaport and, of course, our very own Dr. Jennifer Ashton. First of all, thank you for opening up about this.
Well, listen, I know that this affects a lot of people. I hear this from women all the time. Obviously, men deal with losing hair and thinning hair, but it really is upsetting for women. And I was like the first in line pretty much to try this new treatment. And I exaggerated. It wasn't that painful. I have a low pain tolerance.
Before we ask the good doctor,
yes,
are you happy so far?
Oh, it was incredible. I've done 4 treatments. I saw an improvement in this area and this area, which was really where I mean, look at that. You could see right to my scalp. I started to see a difference in 2 weeks. Now it's been about 4.5 months, and I see a huge improvement.
So let's talk
Dr.
about
Rappaport.
PRP, right?
Yeah,
it's
so
used for so many things.
Platelet-rich
Plasma.
Yes.
How is it helping in hair loss?
Well, the plasma has a lot of platelets in it, and the platelets have growth factors. There are about 7 growth factors in the platelets, and what that does is 3 things. 1, recruits new hairs to grow. Number 2, keeps hairs that are there growing, and most importantly, stimulates the stem cells that are around the follicles to get thicker. So that reverses the miniaturization of the follicles.
So really different than any other technique that we've used in the past.
Well, in the past, there's been surgical technique, as you're well aware of, and then there's the non-surgical technique, but there really hasn't been a game-changing technique like this where we can see results that are really quite substantial.
So as a game changer, the thing I always am curious about is the accessibility of it. Is this something that is fairly easy to find someone able to do it? How much would it cost? Those kinds of things that matter a lot to our viewers.
This is one of the best kept secrets in dermatology. There are very few dermatologists out there that are doing the treatment. I really don't know why. The study in the key journal of dermatologic surgery showed that 62 out of 64 people got positive results. It's not going to be so easy to find people who are doing this type of treatment. In my office, we charge either $400 to $600 per session. The price varies throughout the country and depending upon what technique is used.
Yeah.
You want to know what's funny when we talked about studies? You know how you know a study has been done and a really good one? It's when Dr. Ashton gets the treatment. Because this one here, she knows her medical research. We've talked a lot on the show about PRP therapy. Some of the things it's being used for really don't have the great evidence. For other things we do, sounds like this really is going to be one of those game changers because a lot of people have thinning hair and a lot of people don't want thinning hair. I'll tell you, hopefully coming somewhere near you. We'll, of course, have more information on our website, thedoctorstv.com.
Thank you.
Thanks for taking such good care of Jen. And Jen, you do look fabulous, if I may say. We'll be right back.